ever woken up with a throbbing headache, felt pressure around your eyes, nose, cheek area, or on one side of your head? Have you ever had a cold that doesn't seem to go away? These could be signs of a common yet often misunderstood condition known as sinusitis. Sinusitis, also known as sinus infection, is an inflammation or swelling of the tissue lining the sinuses. Normally, our sinuses are filled with air, but when they become blocked and filled with fluid, germs can grow and cause an infection. This condition can be quite a nuisance and significantly affect your quality of life, but fear not, it is usually treatable. The symptoms of sinusitis may vary from person to person, but they generally include a runny or stuffy nose, facial pain or pressure, loss of smell and taste, cough or congestion, fatigue, bad breath, fever, and dental pain. Now, imagine going through your day with these symptoms. It's not a pretty picture, is it? The causes of sinusitis are manifold. It can be triggered by a cold allergic rhinitis, a deviated septum, or growths in the sinuses known as nasal polyps. Sometimes, even changes in atmospheric pressure can lead to sinusitis. Diagnosing sinusitis can be a bit of a process. Your healthcare provider might start with a physical examination, which includes checking for physical signs of sinusitis, followed by medical history evaluation. In some cases, a CT or MRI scan might be required for a more detailed view of your sinuses. Now that we've covered the basics of sinusitis, it's time to delve into treatment options. Treatment for sinusitis depends on the severity of your condition. For acute sinusitis, simple remedies like rest, hydration, warm compresses can be quite effective. Over-the-counter medications like decongestants and pain relievers can also provide relief. On the other hand, for chronic sinusitis, your healthcare provider may prescribe antibiotics or nasal corticosteroids. In some severe cases, surgery might be necessary to remove the polyps or to correct a deviated septum. In addition to these pharmacological treatments, there are also holistic approaches to managing sinusitis. These include using a humidifier, inhaling steam, staying hydrated, and using nasal irrigation systems like a neti pot. To summarize, sinusitis is an inflammation of the sinuses that can cause symptoms like facial pain, runny nose, and congestion. It can be caused by various factors including a cold, allergic rhinitis, or nasal polyps. Diagnosis usually involves a physical examination and potentially a CT or MRI scan. Treatment options range from simple remedies and over-the-counter medications for acute sinusitis to antibiotics and potentially surgery for chronic cases. Holistic approaches such as using a humidifier or nasal irrigation can also be beneficial. Remember, if you suspect you have sinusitis, it's important to consult with a healthcare provider for an accurate diagnosis and appropriate treatment plan. Don't let sinusitis fog your life. With the right approach, you can manage this condition effectively.